Hello, everybody. Hi, Alka. This is
Evening, is it not normal time for you?
this is 11:26 in the morning on
Oh,
Saturday.
okay.
Okay.
Oh, okay.
So, so I was talking about these myths that we have seen in the healthcare field. It's still going on with a lot of people. General public are really taken for the ride, and I don't think they get the correct information and stop to look at deeply. So I thought I will talk about my perceptions as a you know long-term physician and seen all the games of the insurance companies, pharmaceutical companies, healthcare administrations, and local and national health policy and all sorts of things, right? So I was doing this like a project, like 3 4 days probably. Yesterday I started talking about it. Were you there, Alka? I don't think you were there, right? So
No, I think I was asleep. Was it last night did you talk
yeah,
about?
last night probably it is
No,
midnight.
sorry.
Yeah, midnight for you. So the deal is we end up at the not receiving the right care. That's the main thing, and also living the life for a while, and then when something happens, then it is too late, right? That's why. Like we're putting all the lot in the insurance companies thinking that they are going to take care of us. All we have to do is get a job that gives good insurance, and then that insurance will cover everything. And suddenly they find out they do what's called private pay. That means a large amount of what you are really paying has going up, so people have more out of pocket expense that comes out of it, right? So that's a myth. The myth is that insurance companies really take care of us, so we need to uh, we can rest and after we have good insurance. And also, the Cadillac type of insurance is available to legislators, the um, people who is in the real privilege bracket or the millionaires and all of that. But even then, they kind of shortchange people about insurance care. And ICU is very, very high. All in all, the insurance either private or is it Medicare, Medicaid, uh, they're kind of fall short of their promises, and also they try to always find the ways to not to pay. I kind of support myself as a physician because even the cost of the test, we were not getting it. Lots of times we had to pay out of our pocket for the patient services. That's how the independent doctors, private doctors are not able to afford the independent clinics anymore because the insurance companies really play a game. Where they get the patients to sign some things that they may not be thinking at the time. And then when the time comes, they say it's all deductible to get $1,000. That means they have to pay and they pass it on to the doctors and then they never pay the doctors. It's a very difficult thing for many practice to collect these deductibles, right? Uh, so that's one myth. What do you think about that, Alka? You're in healthcare administration, insurance companies.
I think sometimes it's different here. We've got NHS
Ah,
and
yeah,
we all work hard and we
yeah,
pay for it. But I think in America it's different.
yeah,
But I know in India the concept has come
yeah.
of the insurance since I left in India.
Uh,
But I think in India they are very clued up and they are lots of options. But I
uh,
think there are not as many options in the US probably. That's what
mm,
my
mm,
thinking is, and they're more stringent with it. But being in NHS and getting everything paid for, I sometimes feel
mm,
it's better
mm,
if, because I'm working hard,
yeah,
I should be able to get
yeah,
all the help, but we don't get it here. So
mm,
maybe it should be a mix of both, here people who don't work, okay, because they've got the most time as well, they
Mm.
can get the appointments whenever they want. But when we are working 7 days a week or 6 days, we can't get the appointments with the doctors. So
Yeah,
it's a bit of a both, isn't it? So I don't think free healthcare works either. As
yeah,
you're saying, paying
yeah.
insurance doesn't work either, isn't it?
Absolutely, because just because NHS says that they have the rationing, they have the cautions, they have restrictions, and the budget, all those problems are there. But we can never expect any system to pay for the whole thing. My point is, what is our role in it? Being aware of the practices, current, all those things that are okay. But then maldistribution of the coverage, because some people here, especially communities, they don't get any care at all. Even if they get, it's very, very poor, right? So what I'm proposing all the time with my patients and everybody is, how much responsibility are you taking for your wellness and then not dependent on these people? So the tendency that we carry insurance and everything will be okay when we get trouble, and then it acts on the other way. People are so afraid to be without insurance. That is a more a problem here. At least in Europe and England, like Alka was talking about NHS, you have some security that if you get sick, you can go and then you'll get treated, and then you may not have to pay a big bill. But here, that's a terror for a lot of people. Unless I have insurance, I don't have security. The people really are afraid because they go to the emergency room and then the emergency room charges a lot, and they may give some break for you down the line. But when you don't have insurance, this fear always rules people. So that is there. They fought very hard to for the Obamacare and all that. But even that is also eventually watered down because they had to bow down to the pressures of drug companies and insurance companies, because they said if you allow the Canada or Mexico to export all these cheap drugs, we are going to really squash the plan. So they have to give in for the insurance companies. I know a senator in I think it's Minnesota somewhere, and he was very much about getting the prices down for the drugs, prescription drugs, but they would not allow and let him win on that. So still the same story. Drugs cost a lot more. Suppose I go to India, the same Lipitor will come for me in terms of the rupees and convert to the dollars. Maybe $5 I'll get the month's order. Whereas here it's like 110, yeah, or something. Insurance companies may pay. There's so much war going on. Anyway, taking that myth, if you have anybody has that, an insurance company you can rely for your good health and better health down the line and better services, is a myth. That's all I want to say about that. you know the other myth, actually I was making a couple of videos. They'll have more in there in order and discussion, but here I want to see what people can tell me about what they think about it. The other myth is thinking that all your providers, either doctors, nurses, pharmacists, or any of the healthcare workers, they take care of their health very well because they know it, they can see it, and all that. Totally untrue, because they don't take care of themselves. That's why I get to see the burnout people, stressed out people. Even in the hospital, if you go there, you can see there's a big struggle going on. Trying to retain doctors to go out of the profession because of the burnout has become a big challenge, right? What is the situation in your UK, Alka, about the doctors um, having these problems and getting out of the profession?
It's the same thing.
Yeah.
We had a couple of months ago one committed suicide
Yeah.
in Queen Elizabeth, one of the biggest hospitals in Birmingham,
Mm.
and they were talking about burnout. They were talking about stress,
Yeah.
that she didn't get the support, or how much the peers or people above them
Yeah.
were giving her a hard time. And yeah, you do hear the same as us.
Yeah.
So it's the people who are on the top.
Yeah.
They get that much stress from because there's so much pressure
Hmm.
that you end up working time frames. You've got to do action plans.
Yeah.
Funny enough, talking about the action plans, what I said last week,
Hmm.
I said, when I do end of life care plans for everybody, I said, for me, I'm not going to do an end of life care plan. I'm going to do an action plan because I'm sick of doing
Yeah.
action plans.
Yeah.
So definitely, yeah, we all
Yeah.
get burnt out, doctors, nurses, because
Yeah.
they're trying to cut corners and sometimes they're trying to put limits on. Definitely, I agree with that.
Yeah. See, the one of the things about burnout phenomena that's going on is eventually it is coming on to good patient care because they are burnt out and they are not able to really handle the job at some times, and then bad decision making or not showing up the work or so many ways it can affect the patient care. That is what the public has to realize, that doctors themselves may not be taking care of themselves very well. Why they should be knowing about this is when you select a physician, when you select this institution or any society, any particular multi specialty clinic or all that, you got to see how quickly you are seen, how quality attention is paid, and how follow-up was done. All those factors you can evaluate and see somebody is really burnt out or not. So it's the safety of the patient is involved. So I'm always worried about this because I was in this burnout since 1985. I have been advising physicians in a non-formal way. Now I have a setup, I have a course, I have a book and all that. So people get that, and then I personally interview them twice a week for 12 weeks, and then give them what is the problem, what they should do, and what the transformation should be at the end of it. There is simple daily things that we could do. We could do that. But the myth about all the providers take care of themselves is really still prevalent. People are surprised when you say there are so many numbers of people are committing suicide in United States, for example, more than 200, I think, last year. That's a real problem. There were people who are really put in the circumstances beyond their control, and then too much patient load, too little support, and too much work. The work has gone up with the EMRs because of the documentation and all that. So many things, and so many people are interfering with that too. So doctors are basically demoralized. So I just want people to be aware that there is a lot of problem there. I myself with the people the stress from 1984, I think, when I was stressed out because of the newness of the country and the things that they gave me responsibility too much, right? But then I read a book by Healing the Healer. That's the title of that. And then I was able to revert back to my yoga practice and then balance that with personal life and all that. That helped me a lot. And then get reputation that I could my calming mind and sleep and nutrition, those kind of things I was to advise people. And also I was listening to people and then helped with their relationship and all that. So that grew, and then there were demands on me to go and find out more because I wanted to understand. So that's where I was in the ancient wisdom in a big way, and it has grown on me. It has been very helpful for me to the extent that last 10 years I did not take any medication. I think the last time I remember was in 2014 when they gave me some pain pills. That's all for the hospitalization and all that. But after that, I never. I actually I refusing taking medication, and they were nurses were fighting with me. No, no, you should take this pain medication. No. So anyway, uh, my point is that we could live a life that is proactively uh, lived, you have the proactive wellness on top of your mind, so that you can devise a lifestyle that will be beyond these myths and beyond. So you need more awareness, you need more attention to what's going on with the healthcare as a whole in relation to our own wellness. That's how I shaped my company, my services, my daily do things that I do with the wellness club or the talks and all that, right? But many are known to just believe the myth that all the products are okay. They take care of themselves very well because they know this. They are, but they are human beings first. That we have to remember that, right? And then many people go through. My involvement grew more because first thing is the physicians are suffering. Second thing is they are leaving the field. So potentially it is forecasted that there could be a national emergency when enough number of people go. And now with the advent of AI, a lot more people will be lost that way. There will be so many decisions made by the probable AGI or even below that, and a lot of doctors may go obsolete. Especially the ones that are doing general with the mind and all that, not a physical skills, not a particular specialty and all that. Even then, lot of surgery is done by the very precision robots and all that. So we can see a lot more changes on that way. That is also going to be a big headache for the people down the line. But what I am saying is, even if somebody takes over our mind, now we have the responsibility to take care of our wellness, and that's where this proactive nature of ours comes into. That means, um, what is human being? What I'm supposed to do to enhance this? What I'm supposed to know the limitations of being a human being, and then how we'll go over it. For me, spirituality is the answer. So I'm always in that first, and then coming to the society after that. So when do spirituality, that means you go into the ancient teachings, and then they talked about mind and inner nature much more. So my very first talk on wisdom, for the people who are on wisdom, if you want to check it out, I think 3 years ago, maybe there are 300 some, I don't know how many now. Last time I checked, they were like that. But the first talk I did was on spiritual self-realization is the healthiest state. There's a lot in that, but that is something you may want to listen and you want to consider that. So based on that, my services are born. The wellness club I do actually oriented to the stress that we encounter in the modern world, because we are all wound up, we all have deadlines, we all have hurry, worry, and all those things, right? Um, that was not the case earlier. There was not this much of dependency on technology. And one thing is using technology, okay, but why do I have to lose our own assets? That's what I'm saying. In the proactive wellness, what I talk about is how can you enhance the positives as a human being. I mean, this is very commonsensical. Nothing really involves any money. It involves understanding. It involves awareness of what's going on in your life, and then adopting some of those things, not because of some religious, some fever. That's not it. This is because intelligently you could see for yourself what is good, what is not. For example, I say, don't take medications as a habit. Don't take them unless you need them. Many people don't pay attention to that. They take multiple medications for multiple problems, and then they interact, they have side effects and all that, and afterwards they end up being on them forever, right? If you take any nursing home patient here, I just said, we are supposed to mention the disease for which this medication is. Suppose I'm giving some Xanax for anxiety, I have to show that. But then Once they are on that, they leave it on, and then they pass on to one provider to other provider without really understanding why we are giving or what. They may have, you know, got better with anxiety. They may not need the medication, but then they are tolerant. They have power, habit formation, and maybe to the addiction, and then they will continue them continuously. Okay, they don't have the time to deal with the anxiety in other ways too. You know, so that's where I say, okay, before you come to the state, can you understand the myths you have developed over the healthcare system, and then break them, and then take active role in your own wellness, and then apply these good things from the modern medicine and good things from the ancient wisdom. That is the combination I kind of employed for myself, or for my company, for my family and everybody, right? So it's like a clean living. It's like a living common sense, living with some kind of awareness of what's going on. That kind of, suppose you know this particular restaurant serves a very high, rich, tasty, but not really good for your health. You should be aware of that. You not go and eat it every day just because it's tasteful. One of my friends, who is a actor, is a good guy, but then he doesn't realize what he's doing. So I kind of talked to him about it too. He developed these vlogs where he goes to different places. He's an actor in 13, 14 languages, I think. He goes to different states to do his shooting as an actor. And then carries a camera, and then he goes to different small hotels and all that. And the most of the food he is eating is not advised for health. Okay, it may be tasty, it may be not, but then they are full of carbohydrates, full of oil, full of salt and all. But then he takes so much pleasure in picturizing that and then showing them. But what is the consequence at the end of it? We health system and everybody is trying to help people to eat nutrition problem, and it will cause so many problems, right? But then he goes and reads all this tasty but harmful to health. Suppose you are diabetic and you are eating those carbohydrate food like idlis or dosas all day. You're going to what actually some of my own state in India is the capital of diabetes because they eat lot of rice. You don't want to promote that. You have to realize that and then cut down on that, right? So that kind of lack of awareness of their activity, how it is contributing. Suppose he is at home, he is doing it. He is only doing 1%, but he is has millions of followers and is doing this with glee. Like this is a good thing. So I kind of brought it to his notice, but he has to change himself. He's a good guy, otherwise he doesn't mean bad. But then sometimes you don't realize what you're doing is got a social effect, right? Uh, so what do you think about that, Alka?
I agree with you. Do you know when residents come, or I call them people come to live with me,
Yeah.
I say to them, the social workers will come, they'll check on their care plans, and they say, "You're not doing this, you're not doing this." I say, "Give me a 1 year old, and I'll give you a healthy 80-year-old." I said, "If you give me a 65 plus and a 70-year-old, I said, all I'm doing is management,
Yeah.
medications, because at that time they've been 15 or 20 years on these meds.
Yeah.
But we are quite good with our meds. I
Mm.
would every 4 weeks when we check the meds, we'll say, why is this person on it? Can we review it with the GP? The way is the rules and regulations
Yeah.
are here
Yeah.
that every 6 months or every once a year, everybody's medications should be reviewed. Like I had one resident, she was on diazepam.
Yeah.
Why did it start? I looked and looked. We got the GP to look at the records. We could not find why
Yeah.
that lady was on that medication.
Yeah.
So then we found out, well, she's been having it 10, 15 years. It took us over 2 months, and we've got rid of that medication. She doesn't need to sleep.
Yeah.
She sleeps well.
Exactly.
And yeah, we had to see the effects. We cut it down, tapered the medication.
Yeah.
So, but psychotic drugs as well, there is a lot in UK. We do a lot of work in mental health. Is our general practitioners aren't allowed to give psychotic drugs because they don't give it. It doesn't cover them.
Yeah,
Mental health has to start it because you just don't want to start the psychotic or people sleeping.
exactly, exactly.
Yesterday was in the news. Two nurses were done because they wanted an easy shift and they were giving medication to people to sleep. So they
Yeah.
could. It's ridiculous. I know it was in the news yesterday. Two
Yeah.
nurses were done
Yeah.
because they prescribed those medications. But no, the medications is not for fun. If they don't need paracetamol,
Yes.
they don't need paracetamol. Do you know what I mean? They don't need laxatives. But
Mm.
average 85-year-old,
Yeah.
they would have
Yeah.
a lot of medications.
Right.
And I've noticed some people who've got dementia or they've had early dementia,
Mm.
they stay on those medications and they stay on less medications.
Yeah.
Because with people with they can't really tell what's wrong sometimes, and we have to anticipate it.
Yeah.
So yeah, I agree with you. It's your health you have to look after, nobody else's. But I think
Yeah.
our generation, I'm 50,
Yeah.
but my kids,
Yeah.
they are more well versed with carbs and everything else.
Yeah.
That's what I feel. But there is a lot more awareness than it was 50
Yeah.
years ago when I was growing up, isn't it? So I
That's
think
yeah, that's
we'll
very
make
true.
better adults
Yeah.
in another 20 years because they are looking after themselves.
Yeah. Yeah, my son also is very aware of all this, very aware of smoking. I never smoked, he never smoked, and all that. And I didn't have to worry about him going out or picking up because the push from the awareness is so strong. And he himself went and campaigned against smoking in other people, So what I am saying is what Alka was saying about 60-year-old coming with so many medications because especially 60s, 70s, 80s, people kind of relied only on medications, multi-medication, polypharmacy, we call it. Even now, it is going on. I know one lady come to the clubhouse. Her name is Tracy, I think. She was telling how her friend had 40 medications, and then he was feeling so down, and then she went through his medications with the doctor and slowly cut down to four or something. And he became very, I mean, he lived well, but later on he passed away. But then his quality of life was good when he was on what is it is necessary for him rather than that's something going on for polypharmacy. People just put the medications routinely as though that's the only thing. If you don't want medications with the patient, you got to do a lot more work. You got to taper them down. You got to watch them. You got to be careful about taking away something that they need it. They are used to it. So it's a lot more work when you are cutting down this. And also they will be fighting from the patient's relatives. Patient, they will be fighting with you. Why are you cutting down these medications? But once you establish the lifestyles, once you establish the care that you want to give for them, and educate them about this. I call what is called intelligence of our body, intelligence of our mind. You know, People don't think that body can heal itself on many things, provided you are not standing in the way, not chemicalization, not all these environment agents, the antibiotics in the foods and the fertilizers, insecticides, and all those things are not there. The body's natural intelligence works, and then simple thing I tell them is follow your physiological processes. Don't eat unless you are very hungry. You know, you don't have to eat so many meals actually. But then you also have to be aware of your physiological crisis. You get up in the morning, you are fasting all night. So in the morning you can freshen up, and then you have a good appetite. Then have a good breakfast. That is containing everything, and then just have a light lunch, and then a light dinner in between, maybe healthy snacks. That is very difficult for people to follow because of the we consider other work is important rather than our own health, right? That people think that's selfish when you're doing that. No, you got to incorporate them. Like for example, I tell them, okay, you don't have good food in the hospital because lots of time the cafeteria closes by the time they have time to go. So I tell them, why don't you prepare something at home and carry it with you? So that requires some discipline. Like I told my son, cut down some carrots, cut down some celery, cut down some broccoli and all those, and put them in a cup, and then cover it a cup, and then take it with you and have it like a light dressing, and that would be good snack. So not all the time, maybe once in a while. So instead of going for the rubbish food, you have to replace it with the vital nutrition. That itself is very difficult for a lot of people. But proactive wellness is where you are aware of the things that can come to you, and where you are aware of the habits that are breeding these things, and then taking care of them. Avoid the bad habits, cultivate the good habits, maybe one at a time. This polypharmacy is definitely not only causes problems and also physiologically, but also quality of life is taken away from the patients, because Alka is saying, you give diazepam to old people. That's actually benzodiazepines is not a good thing to use in that age group. Temazepam and diazepam, all the esteril, all these things, they we used to use them, but nowadays we don't, right? But you start them and then you leave them for decades, then it's very difficult to take off. For example, sleep, reticular activating system affecting by these, all the somna, uh, uh, melatonin. Young kids are taking melatonin. It's unbelievable. 17, 18 years old are taking melatonin. You are not supposed to mess up with that physiological phenomena of sleep. Don't take them unless you have some injury, some surgery, some real exhaustion where you cannot sleep for 4 5 days. Don't take them like that. Now this has become a habit. So they're killing that. For example, I never took any sleeping pill, if you believe or not, Alka. I never took it, because I have studied sleep, I have understood. I was not sleeping very well as a doctor because I was woken up all the time. But then I studied both ancient and also modern, and then I understood the sleep cycle, and now I'm respectful to that. And I don't take tea and coffee too many times. So maybe once in the morning, maybe sometimes, but I don't have to take it. I'm not addicted to that. But then we maybe the breakfast somewhere. I mean, sip it. That's it. But then avoid those stimulants as much as possible. The energy drinks, the alcohol, all those things, right? The drugs and everything. This kind of very healthy living is considered like a no living at all by many people, but it's not. Actually, you have more energy, joy, and awareness in your life, so you can really overcome so many situations that need your attention, that need your complete awareness. So sleep is a big deal, and I teach people about pre-sleep, during the sleep, and after sleep, what you can do to change the whole thing. you know. Alka, how is that sleep thing, that you have any questions on that or anything?
No, I missed a little bit. Sorry, I was bringing the shopping in, but no, I'll let you carry on. Um,
Yeah, I mean, what I'm saying is the physiological phenomena that we don't pay attention: hunger cycle, sleep cycle,
oh yeah, yeah,
yeah,
yeah.
energy
Okay,
cycle.
okay. We don't. I
Yeah,
think I'm not saying as we get older, we eat 6 o'clock, half six. Can't eat real
yeah,
full food. It's better to eat.
yeah,
What do they say? There's a saying, isn't it? Eat breakfast like a king and something like that, and
yeah,
then
yeah,
night like a pauper or something like that. There's
yeah,
a saying, isn't there? No, you should eat your heaviest meal,
yeah,
and then go down and down, so you're
yeah.
not sleeping and you're.
You see,
Yeah,
if you are getting up in the morning, that is true. Eat the biggest meal at breakfast, because you have normally, but then late nights, staying up all day, this internet age and information age, people are sleeping at 2 o'clock, 3 o'clock, so they cannot get up. But then normally, if you go to bed at 9 to 10, and then you get up in the morning 6 o'clock, that will be very good for you. And then you have to maintain that. But this night working and all this is really messing up people. So I teach them some place of where you can do 20 minutes of nap in between. That will really rejuvenate your energy, but basically be in touch with your own physiological phenomena, cycles, right? There is this, I mean, there is so much knowledge in other systems where they will maintain detoxification, they will maintain natural intelligence of the body better. Yoga, Ayurveda, um, some of the systems I know, they helped me very much. Right now I'm taking a certification for yoga, not yoga, Ayurveda, because I teach a lot of nutrition from that point of view. There they will tell you, you want to be hydrated, you want to be doing deep breathing quite a much, and then also you want to eat freshly cooked food and mostly natural food, and also know your body energy type, and then eat accordingly. For example, you are a laborer, you are doing a lot of work. This a lot of people are not like that. Then you have to, be protein high, rich food. You have to do that. But then if you are like a intellectual worker confined to the chair and all that, you need to really do the food that is stimulating your mind. There are you can select the food groups. A lot of people know about these things now. So important thing is, what is proactive wellness, what is our body intelligence, how do we make change in our lifestyles. I call them therapeutic lifestyle changes, which I make to the patients and also to the people who come with the stress and all. They don't pay attention to that at all, and that's why they don't have enough energy, and they go into these irritable moods, and they take it out on everybody, and then things get complicated that way you know so these myths in the healthcare system, one of them is, um, we will not know about these things unless something comes and tells me, like an event. You are sick, then I will notice it. Otherwise, don't bother about it. Just live it up, eat and drink and sleep whenever you want. So you kind of, I call them circadian rhythms in the body. Everybody knows that circadian rhythm, not me calling, but in medicine we call that. These rhythms are much more explored in the ancient systems of yoga, Ayurveda, and all that. And then they have a very healthy lifestyle. And among them, they said a very, very healthy breakfast with all the groups of food, and light lunch, and very light dinner, and in between nothing. But in yoga, they talk about real yogis. They eat only once a day, and the persons who are running the household, they can eat twice or thrice. But then always be hungry and eat. Don't eat according to the time, but according to your body's clock, you want to eat. That kind of. So this series I'm doing, this morning also I was doing something. My computer has given me some problems, so I was doing that. As it is repairing itself, I thought I will come and talk to you guys. So I just opened just like that. There are some people on the um, wisdom, and if anybody wants to come up, you can come up. Alka is talking to me here on the clubhouse. So nothing is planned, just I came. But tonight I'm going to bring those videos. I have them, and I will bring them and pin them, and you can see them, because it will start with the myths, and it will go into how I want to help people to get rid of the myths with good information, and then take care of their proactive wellness, I call. And then it goes into my wellness club philosophy and how it has developed. Then you'll know what I am, what I'm doing, why I'm doing, and all that, which is, I think, generally useful information and beneficial. But then, as a yogi, I'm very disciplined without really punishing myself. Okay, the habits breed on themselves, and one leads to other, and all that. So I have a very joyful existence, you can say. Other circumstances are bad out there. I don't really, uh, get affected by them. That's a good thing, I think. And then I never take any sleeping pills. I never take any pain pills unnecessarily. I didn't have occasion to take them anyway. And uh, one thing is energy. People think if they take something from outside, like energy drinks or drugs or alcohol and all those things, their energy will go up. There are so many myths with that. But there is one myth. If you work, you will lose energy and then you will be tired. Yeah, at a physical level, maybe a little bit you have to rest up and all that as age goes on. But there is something called renewing energy by itself. So that means when you work, if you are in the flow state of the work and then you're really enjoying that, you don't have to expend any energy. But to come to the flow state takes a lot, a lot of it. So Alka, what do you think about energy?
Yeah, I agree with you. Don't eat
Yeah,
if you're not hungry. But I'm a person who can get stressed and ulcers if I don't eat. So
yeah.
since 3 years, I made the decision.
Mm.
Whatever I do, 1 o'clock. My
Mm.
admin, she's lovely. She makes sure I've got it in the calendar. 10 minutes, I have to eat something. So we don't. I'm not eating for. Yeah, that's a little bit of energy giving reminder to yourself. Something small. Because if you eat a big lunch, I wouldn't be able to sit down. So you do get energy from different things, fibers and stuff like that. But that's what these days people, 65 plus, 80 plus, they'll be on tons and tons of laxatives because rather than increasing the fiber at one time, the laxatives would have increased, isn't it? So, and I know talking about movement, eating, and bowels,
Yeah.
I was very surprised in our countries because the type of food we do, we clear our system every day. But here, they don't. Sometimes it could be 2 to 3 days. That was really surprising for me. I don't know.
Yeah, that yeah,
I
that
was
is
like, no, you eat because we eat the right amount and we eat the right things. So
yeah.
it's just output and input matters, doesn't it?
Yeah.
Altogether.
You see, yeah, it is like eating right and the correct foods and all this one thing. But then there are other things too. Hydration is very important. And if you are going into a meeting and you don't drink water, and if you dip like a 3% of water, you'll go lose 50% of energy. A lot of people don't know that. They push, they kind of do that, but that's not good. Okay? You can just simply assume water. And then how you breathe has got a lot to do with your energy. Okay. And further subtle, what are you doing with your mind? Subtle thinking, subtle impression, subtle. So, if you are a person who is attending to whatever is happening fully, completely, then you will expend very little energy. Actually, that becomes more energy prone. It will improve your energy. That is what I call ever renewing energy. So we don't realize we are depleting energy in so many ways in our being through the day. So that's something I introduce to people who are burned out, and they don't realize a lot of the warfare, a lot of the conflicts, a lot of the angers, everything going on within them. They deplete energy due to that. You are angry with somebody, that somebody may not be affected, but you will be affected for sure. So understand all the subtleties will come to the front when you sit down and meditate. These things come up, and then you have to not to dismiss them, not to suppress them, not to say there's nothing, but then you have to really understand where they're coming from, what how you should, and then you shouldn't be repeating those things again and again because that is one thing I don't see in this culture. People don't stop back and reflect on what's going on a daily basis. Maybe they will do it, go to a therapist or somebody, but then therapist will reinforce all your negatives lots of times. So that's not good either. You got to reflect by yourself. So the the inner life that I lead leads to a lot of positives in my life. So I'm trying to bring that to my wellness club, and I train them from the morning till the evening with what they should. Have I told you my routine, Alka?
No, go
Okay.
ahead.
I have said so many times, maybe not when you are there, but basically, when I get up in the morning, I don't touch these devices for a while, right? And then I kind of allow myself to be in that awareness mode, present mode. Look at the plants, look at the life, look at everything around me, right? And then I'm involved in some spiritual activities, that's fine. But then when I'm ready for the work, then that also what is the work ahead, what I'm going to do, everything will be determined. I don't go into the emails and all of that. I only do emails of the people I want to deal with, not advertisement, not the seeking business, all those things I don't pay attention at all. So I have a detox method of dealing with the modern technology, right? So I don't dismiss it completely, or I am not at the mercy of it completely. I am very versed with artificial intelligence now. I can do a lot of stuff with it. I taught myself in the last 3 4 months, but I'm in charge of that, right? And then when I go to work, the present of mind I cultivated in my wellness club in the morning, that is carried on like a perfume through the day. Every 1 hour, at least for 1 minute, I stop and then I focus only on the deep breathing. And then when I'm working, I'm completely attentive right through the day. And when the evening comes, after you come home, I kind of reflect on that before I unwind and go to bed. So I shut off these devices at least half an hour or 1 hour before. Lots of times I don't even have to worry about them because I have taken them off after what I have to do. Then I can sleep completely very well. And there are certain things that I do before the sleep that gives me complete, deep quality sleep. Even if I sleep 2 3 hours, I'm completely refreshed because you got to figure out how to recruit good sleep to help you. It takes some time, but people to get over their bad habits or inculcated habits and all that, right? And then, of course, nutrition, uh, deep breathing, and all those things are there. But this is the routine, inner life. So I don't look for other people to answer me. I go and explore myself inner. Okay, that's called self-inquiry. That's above the meditation. It's not like sitting down and then shutting mind. That's not meditation actually. In the meditation, all your things come up and you have to deal with them and then put them aside. But what I do is called manonasha. That means destruction of the mind slowly. That means the mind as a whole is not there. Only thoughts are there. We think that is mind. So once you are at the stage where you are beyond the thought patterns, then you start to inquire about things and where each thought coming from and all that. So in a sense, what happens then is you are always in meditative awareness through the day. That is very blissful. Hope I gave you a glimpse of what happens. Right, Alka?
Yeah, it's easy to practice some of the things you've said, but you've got to be, I think, regimental and very, very strict with yourself to do that, isn't it?
Just be aware. You don't have to be too harsh on yourself. Just be aware of whatever is going on, and slowly things will change. So you don't have to measure up to anybody's standard, or you don't have to tell somebody I've achieved this. It's not that. It's your inner self. How, what kind of inner. The problem caught in the thought patterns, or emotional reactions. So as you evolve into this, you will be watching them, not being involved with them. That's the difficulty with a lot of people. Anyway, that's a big area, and I know why many people, even though they are meditating at a certain time, rest of the time their mind is agitated. Many people don't know that there's a serenity, there's a silent self within us, and you can rest in that. I do that. That resting in the self, which is serene and calm and peace and happiness itself, is difficult for people because they hung up with their own theories, concepts, and all of that. That's the tragedy of modern man thinking mind is everything. But mind is only a tool, and also there is no real mind as such. Okay. Anyway, there are very individual stuff, and people can do according to their upbringing or their understanding and all that. But that's why you got to go and inquire into yourself, not expecting somebody else provide a positive affirmation and that will work for you. It doesn't. Look at all the self-help we have, so many millions of books, but still, if you look at the number of mental health cases, if you look at the insomnia, if you look at the suicides, everything is going up, and people are not having a quality of life. They don't enjoy themselves basically, and then they don't have a quality of any measure, like nutrition, sleep, or relaxation. And I ask many people when they come and tell me so many things about this theory, that theory, and I ask them, sir, tell me, how is your mind? Is that silent for at least for a while? They say, oh, no, maybe wait a second. They think it's a virtue to be thinking constantly, but that's a limitation. you know think appropriately, think pretty deep and nice when it is needed, but you should have the ability to be not to think and be silent. That is possible if you only understand the ancient exploration of into these kind of things. And that's the problem with the India also. Most of the Indians are aping the West, but they don't know their own inner exploration centuries ago. There's a lot in that. My respect to those meditative rishis who have, through the awareness, found a lot of secrets of the human psyche, mind, and consciousness. Is extraordinary, and I have a lot of respect as a physician, as a scientist, and all that. It's a tragedy that they missed out on all that. If only they have continued that, I mean, so many people invaded, so many things have come, and that's why. But now, present generation is totally, some people are pursuing it, but if you take the mainstream of the youth and everybody, they don't have that. That's a tragedy. They would do much better if they can even tap into 1% of it. And a lot of my principles of wellness are based on that. So I have no problem telling them because they are very superior. They give you not neurosis, stability. They don't give you anxiety, depression, but rather joy in life. They give you the capacity to be steady in times of crisis and focus better and do things much better. You can learn new things and so many ways. Say, like I come on the rooms, not many people come, but still I enjoy talking about it because somebody may catch it. So that's what I don't need to do this, but I come and do it because it's kind of enjoyment for me. So anybody on the wisdom want to come up? Or Julie is there. Julie, I would like to come and talk to me. Julie is a friend of ours, and she does the meditation and all that too. So we talked about living in the present and all that with Julie. So I think she lives in England too, Julie. Akka. Where are you? In Manchester or somewhere?
Near Birmingham, I am.
Okay, okay.
In Birmingham, well,
Okay.
I live half an hour just out of Birmingham.
All right.
I don't know, I haven't got the wisdom up. Hi, Julie, she's listening.
Yeah, she's listening. All right, nobody wants to come from there probably, but I'll talk to you tonight again around 6 o'clock, and this time I'll bring the videos, and then you can see them. Okay. All right,
I'll
Elka.
try.
Yeah,
I'll try.
yeah,
I'll try.
yeah. But they will be there, so you can see them anytime you want. Okay.
Thank you very much. Thank
Okay.
you for the good hour.
Bye
Nice talking to you.
bye.
Bye.